Good day everyone, here are the latest updates on COVID-19 outbreak, not just in South Korea but all over the globe. Today is February 25, 2020. This graph also shows the number of cases in mainland China, and also we have the cases in other locations or other countries and the total number of recovered patients. As of today, there are 80,088 confirmed cases globally, 2,699 deaths, and 27,571 recovered. Active cases 49,818, closed cases 30,270. China has the highest total cases, followed by South Korea 833, Italy 229, Japan 159, Singapore 90, Hong Kong 81, Iran 61, and we have USA 53, followed by Thailand, Taiwan, Australia, Malaysia, Germany, Vietnam, and more other countries. New deaths recorded, we have 71 in China, 2 in South Korea, with a total of 8 deaths. We also have Italy, 7 total deaths, Japan 1, Hong Kong 2, Iran 12. The transmission rate is 2 to 3 newly infected from 1 case. Fatality rate 2%, incubation period 2 to 14 days. However, the outliers is around 0 to 27 days. And right now there are 37 countries and territories affected by COVID-19. This map showed the number of cases in different areas and provinces in South Korea. We have 194 in Seoul, 141 in Daegu, and also in Jeju Island, 25. These are the latest updates on COVID-19 outbreak in South Korea. The government raised its virus alert status to highest red level, advising people to stay inside and avoid crowds. The full emergency situation following the snowballing infections. Government has set up a central disaster and safety countermeasures headquarters under the Prime Minister, and this is the first time that had happened here in South Korea. Ministry of Education also ordered schools from kindergartens to high schools to postpone spring semester openings by 1 week to March 9, and other schools postponed it until March 14. The 16-month-old girl tested positive for coronavirus, and she is the youngest South Korean infected. COVID-19 related deaths in patients are linked to existing medical conditions aggravated by COVID-19. Catholic Times, a religious newspaper based in Daegu that arranged the pilgrimage tour, has shut down its offices in Seoul and Daegu and put its employees under quarantine. Israel refused to allow Korean foreigners to enter the country without any prior notice after they landed in Tel Aviv on a Korean air flight due to entry ban against South Koreans. U.S. State Department also raised its alert level for travel to Korea to level 2 on a 4-level scale, urging its citizens to exercise increased caution when traveling to Korea. Hong Kong bars non-residents arriving from South Korea from Tuesday morning in response to the growing coronavirus outbreak. South Korean stocks plunged about 4% Monday after the number of new coronavirus cases confirmed here nearly tripled over the weekend. Government announced that the patient in the 31st case was responsible for spreading the disease to other followers of the Shincheonji Church of Jesus, and public criticism erupted over the 61-year-old woman for supposedly causing the mass infection. However, the Korea Centers for Disease Control and Prevention Director Jung Hyun-kyung said that the 31st patient and other confirmed patients from the church seem to have contracted the virus around the same time from an unidentified infectious agent. Choi Won-shok, an infectious disease specialist at Korea University Hospital in Ansan, Gyeonggi Province, also said that based on epidemiological research so far, the patient was not likely to have been the spreader. Cases linked to the church are without clear epidemiological links, and the patients appear to have been infected around the same time. And we don't know from whom they got the illness yet, just like a lot of the cases that are emerging. As of the moment, 25 Shincheonji facilities in the region have been shut down since February 18, and South Korea will conduct tests on the COVID-19 on all followers of Shincheonji Church of Jesus. 8 people confirmed for COVID-19 have died in Korea, 5 patients at Daenam Hospital in Cheongdo. 5 of the 7 victims linked to the hospital and 9 medical staff have been confirmed positive. And right now, the hospital was isolated on Saturday. U.S. military raised the risk level to high from moderate. A family member of a U.S. soldier has been confirmed to have the new coronavirus. This is a report from U.S. Forces Korea. And also the South Korea Centers for Disease Control and Prevention informed USFK that the 61-year-old female had tested positive for COVID-19. There are a total of 11 military personnel confirmed to be infected with COVID-19 as of Monday, and the 7,700 service members are now quarantined. Dr. Hakim Dejabala, an American virology expert based in New York, said that the assumption of the 2-week incubation period proved less tenable now because of reported cases that remain contagious past the due time. Another scientist who was head of Institute Pasteur Korea at the height of the Middle Eastern Respiratory Syndrome or MERS outbreak in 2015 said that COVID-19 was more contagious than MERS. COVID-19 thrived in the upper lungs, mouth, and throat, while the MERS virus was in the lower lungs. The means of mass transit, such as buses and subways, can serve as ideal conduit because the crowded space increases the chance of contact and thereby transmission. The doors, handles, and other objects where a lot of people touch are hotbed for the virus. He suggested that Korea should continue to share more information with the world so experts from the outside could help. He pointed out that communication between the US and European countries was smoother than Korea with the rest of the world, enhancing their cooperation in the fight against epidemics. And self-imposed quarantine might soon prove inadequate at the containment stage. The worst case scenario he thought of was a little Wuhan breaking loose in the middle of Korea. Visa waiver privilege for Chinese tourists has been suspended for now to prevent the spread of the disease. Shinsegae Department Store, a major Korean retailer, partially shut down one of its outlets in southern Seoul for a disinfection measure following a recent visit there by a patient diagnosed with a new coronavirus. The National Assembly and its separate members' office building were placed under quarantine at 6 p.m. Monday after a person infected with COVID-19 was found to have taken part in a roundtable event at the office building last week. Public facilities in Korea, such as elementary schools, culture sports facilities, public libraries, museums, galleries, and sports stadiums is closed. Daycare centers will be closed for 2 weeks until March 9. Briefing will be aired live at 11 a.m. every day to inform citizens of the municipality's response to the virus outbreak. And the majority of customers have shifted from offline to shop online instead of visiting the department stores or supermarkets. Last December 31, 2019, World Health Organization was informed of an outbreak of pneumonia of unknown cause detected in Wuhan City, Hubei Province, China, with 11 million residents. And last December 8, the first reported infected individuals showed symptoms. January 10, a gene sequencing further determined it to be the new Wuhan coronavirus, namely 2019 nCoV, or the coronavirus disease 19, a betacoronavirus related to the Middle Eastern Respiratory Syndrome virus, MERS-CoV, and the Severe Acute Respiratory Syndrome virus, SARSCoV. The symptoms: fever, cough, and shortness of breath. It is asymptomatic, and it has 4 to 14 days incubation period, and the possible outliers 0 to 27 days. I am glad to share with you evidence-based information and summarize facts in this video. Keep calm and keep being informed. That's all for today. See you in our next video.